Hello, welcome everyone. We will well, let's see. Okay, everybody is in. Great. Welcome everyone. Thank you for shifting from a originally scheduled in-person Veggie OCFSN working group convening to this virtual space. I hope that allowed a few more folks to jump on today. We are starting to record this session, and we're really excited about the agenda today and hear from all of you. If we want to kick it off this morning, and I want this to go into it says, okay, meeting group chat, great. If you want to share your name, pronouns, and what's something important to you or your organization that's happened over the last 2 months, and 2-ish months. It could be 3 months. Whatever, something that's important to you, maybe something that you're celebrating, maybe something that is coming up in the next 2 months, but you're really excited about and working hard on right now. But if you want to think that over and add that in the chat for everybody to see. And while you're thinking about that, we are going to talk a little bit today about kind of centering ourselves around what is the OCFSN VeggieRx working group all about. There might be some folks that have been at this work for a really long time and other folks that are new to this, and kind of reviewing where we have come and what program needs exist, what strategic goals we've set out for ourselves in the past, and how can we reignite those and prioritize those now to give ourselves a little bit more direction in this work as a working group and how we're collaborating together. We'll have time for breakout sessions to really dig into this, probably in pairs with folks or groups of 3. And then don't worry, this is a 2-hour session, so we'll give you a break to stretch and get some water, go to the bathroom or whatever you need. And then we're gonna go through kind of next steps and oh, thank you, Jen. Here we go. Here's the agenda here. And to start us out though, if Shin, our fearless leader here, wants to, for OCFSN, wants to give us a little bit of updates network-wide and some funding opportunities here.
Yeah, absolutely. So hi everyone. For folks who haven't met me before, my name is Shin. I use she, her pronouns, and I am the network coordinator at the Oregon Community Food System Network. And thanks, Kaylee, for kicking us off. For folks who haven't met Kaylee, she is our VeggieRx working group coordinator. So in terms of network updates, there's always a lot going on. So I just wanted to highlight 3 things that are happening right now. We're currently in the hiring process for the Regional Food Business Center state coordinator. So that will make our little team of 2 turn into a team of 3. And for folks who aren't familiar with the RFBC, that is the USDA Regional Food Business Centers, which were created or they technically went live in July 1st. And we, Oregon State University and Colorado State University are the 2 co-leads for the Northwest and Mountain State region RFBCs. And then the second thing that's really exciting is this past legislative session was pretty incredible, and we are expecting for over $4 million from state funding through what they call the Christmas tree bill. And we are planning for that to support the regional food system through food hub safety and infrastructure grants, as well as disaster resilience grants. And these programs are currently in design, and this is a whole long story for folks who maybe aren't as familiar with the policy side of things or directly on the farming side. But in 2022, OCFSN had received $1.5 million for disaster relief grants. And that was to support producers who suffered losses due to natural disasters in the 2021 farming season. And that was kind of the first of its type in terms of being able to capture a lot of producers who were much more small scale or beginner. And then the last thing is OHA, so Oregon Health Authority, and so Jen Chandler and myself will be representing Oregon at the Center for Advancing Healthy Communities Summit in San Diego at the end of this month, and we'll be sharing our experience with the SPINE grant, which right now we are in year 2 of, and then a lot of that particular conversation will also be part of a small panel, and that's really exciting because what we're really talking about, what we're going to end up talking about is the ways that cross-sector work intersects. So the policy piece of it, understanding systems, as well as like environmental. So how all of these things really tie together for our health. And then just a quick list of a few upcoming events. Next Friday, I'm hosting the first BIPOC gathering at Black Futures Farm. So it's a small group of about 30 folks who have been engaged with OCFSN or partners over the last few years. And then a reminder that in September, there is the Small Farm School in Oregon City. We'll have a table there. And then on the 14th, you should be hearing more from Healthcare Without Harm, but there will be an info session for the Oregon Farm to Institution Collaborative. And then in October, there will be a really awesome event. It will be the second ever Native Food Sovereignty Symposium up in Washington that's being hosted by Feed 7 Generations. And then we are going to host our second regional convening of the year for OCFSN down in Southern Oregon. So that's in the planning process right now, but that will be November 8th through 9th. So definitely save the date. All right. Thanks, everyone.
Thanks, Shin. Sorry, I'm just reading all of these wonderful descriptions of folks. Hello, thank you for being here. If you haven't scrolled through the chat, folks are introducing themselves. We've got Megan from Legacy, really excited about hosting free food markets that have been a huge success. I stopped by one a couple weeks ago and it was amazing working with Mudbone Grown and to get food out to folks. Olivia, hello, from Yamhill County Public Health. Thank you. You're hoping to harness the work. Something exciting is the Veggie is really gaining momentum. That's fantastic. And implementing that in Yamhill County. Cool. Tina, welcome from Umpqua Health Alliance, working on expanding Food Smart to neighbors, including medically tailored meals. Very awesome. Love to talk with you more about that. Emily, thanks for being on here. Emily, you might remember Emily Carlson, who worked a lot with the census data, really created the census data for VeggieRx, and just graduated, congratulations, in June with her master's in public health from OHSU and PSU combined there. Hi, myself, I'm Kaylee. Shin already introduced me a little bit, but I've been working on this human-centered design process for a work project there. Eliza, welcome from Healthcare Without Harms, and working on food and healthcare team and supporting food as medicine initiatives nationwide. Very cool. Have that macro lens. Heidi, welcome from Providence Community Teaching Kitchen and the Garden of Giving, and they're working on publications for clinical outcome pieces, looking at patient engaged in services between 2016 to 2020. Very cool. Marcy, welcome from Greater Oregon Behavioral Health, and which is an arm of EOCCO, and has a very robust program, the Frontier Veggie RX program, and adding into Baker County, very cool as well. Oh, congratulations on new funding from the Roundhouse Foundation too. That is always something to celebrate. Welcome Angel from Growing Gardens as the Home Gardens Operation Manager, getting ready for a garden salsa party. Very cool. Feel free to shameless pitches or non-shameless pitches in the chat too if you want, if that's open to the public or you need more volunteers or whatever. Carla from Adelante, thank you for being here, and excited to expand the produce prescription program and incorporating a mental health component to that. That's very cool. Jasmine, welcome from, or Jazz, hi Jazz, sorry, from OFB. Very exciting, facilitating a health equity advisory council, and learning more about how people think about produce prescription work and strategies to increase access to fresh food. Very important work. Juliet from Thrive Umpqua and the Veggie RX Umpqua program. Very, very cool here. Let's see, currently working on a proposal for CCO funding for next year. Shauna from Yamhill Community Care Organization, welcome, and working with Nutrition Oregon Campaign and creating more pathways for nutrition programming within the CCO structure, also very exciting. Tina, great, from Umpqua Health Alliance, new to the group and happy to be here. We're very happy that you are here too, and very excited that you're working on the medically tailored meal things. Thank you. Okay, I just had to like quickly shout out everybody. If there are folks that haven't had a chance to put in the chat, to introduce yourself, pronouns, organization, and other things that you're excited about or is important to you in the last couple of months have been top of mind. Feel free to add those in. Oh, sorry, I missed Ecole too. I'm sorry if I missed other people. Ecole from OHSU, and is working hard coordinating the farmers market this year and keeping the farmers market alive. Cool. We are glad that you are doing that important work. All right. Welcome everyone. Jen, I'm going to hand it off to you to center us a little bit more about these 3 questions that we're hoping to answer today, or at least pick apart a little bit more and get your feedback on and energy around. So.
Great, thanks, Kaylee. Yeah, exactly what she was just saying. I think that, well, first off, I want to say thank you to everybody for kind of bearing with us while we went from in-person to virtual. And I know that a bunch of people that we were going to go see today and yesterday are on this call. So thank you so much for all the back and forth and coordinating all that. I look forward to making that happen, hopefully in the fall. That's something we'll talk about a little later also. So the point of this kind of convening started because, as we all know, we are like, the main plan was to kind of collect together and go for a larger federal grant, the GUSNIP grant. So we've all been talking about this capacity building and innovation fund and the grant that we were receiving and things like that. But take a step back, in order to even apply for this larger federal grant, we need to have a strategic plan, we need to have a logic model, and we need to have all of like a 3-year plan, a 5-year plan, and things like that to make sure that we're all on the same page and moving forward. So although we're not going to get there today, we have a lot of information that's already in the working group drive, and we just kind of wanted to make sure that people have what they want. This is what we want, just kind of like collective impact, like work together to make sure that we aren't wasting time or moving forward, because we are more powerful together. So I kind of was trying to think of like, what are these questions that we're like, what the point of the involvement of the working group is. And I think that summer is really difficult, obviously, like we just found that out because we're not meeting in person, and that's totally fine. But how do we get more involvement in this working group? What should we be prioritizing? So a couple polls will be happening in terms of like prioritizing these goals from the strategic plan. And then how do we decide this? And then how often do we meet? So that will be like the last thing we kind of talk about. I know that this working group used to meet monthly, and so we might be going to quarterly, or what works best for people. Again, I'm kind of hopping in on this in like right after the pandemic. So please correct me if I have this information incorrect, because I'm going off of what I find in the folders and such. Okay. Okay, so now we're just kind of going to go through things that I have, like we have seen, what you said in the past, and what we have so far. So, quick poll. Shin, would you mind posting that? Okay. Have you ever viewed the OCFSN VeggieRx Working Group Member Drive, and have you utilized any of the templates resources for your program or organization? So just take a quick minute to fill that out for me, please.
And I know there's so much information that's available from the network and also from partners. So this poll is in no means trying to shame you into, admitting that like, oh, you never opened a drive. We've got a lot going on. So I think this is just helping us understand where people are at, where awareness is, because we have new and old folks on this call, not age-wise. And in terms of familiarity. So just wanted to make sure that we are doing a good job of communicating where things are, what things exist, and understanding what still needs to get created. And also trying not to recreate things that don't need to be recreated. Great, so we got 16 responses. I'm going to end the poll so folks can see the result. Okay, so it looks like about half of you have used the Google Drive before, and a smaller handful have actually used the templates and resources. So I would definitely encourage any folks who have used the templates and resources before, if to give us feedback at any point, and probably not right now, but just kind of keep that in mind and see if there's things that that have been really useful that you think we should highlight more, or things that have been missing. All right, I'm going to stop sharing the poll.
Great, thanks. And then as the agenda said, there will be a point and there's going to be a Jamboard. So there will be a place that you can like list examples. So if you're like, oh, I actually found this toolkit really helpful, I think that you should put that, you can like enter that into this space, and we'll get into that. I'm getting a little ahead of myself, but that's really good to know. So then we kind of wanted to just put the vision and the mission of this working group, because as we're talking about, every time I say like strategic plan, I'm referring to a draft that we've sent out that it was from 2021, I believe, Kaylee. I think that was like the strategic plan goals are for 2021 to 2025. So anytime I say strategic plan, I'm referring to a draft. So yeah, let's just keep that in mind. So this is the draft vision and draft mission. I don't think I need to read that to you, but we just kind of wanted to like post that also.
And I might clarify that instead of draft, like any strategic plan, it's a working document, right? And so we had to start somewhere. And I think because it's a working, living document, it somewhat, was accepted as like, this is kind of what we're doing moving forward with that group, whoever was involved in 2021, but actually committing to that work and making sure that some of that work was going through like any strategic plan, there's going to be ups and downs to that, and adaptations and things that you don't necessarily accomplish because maybe it was very lofty, and we're living through a pandemic, and so some of that just was not possible. So I'll link this into the chat too now, that document that we're talking about.
Great. And I did yesterday put in a PDF version of it into the Google Drive, just because I know that the viewing of the one that's like labeled draft as a Word document is a little bit difficult to kind of change the view sometimes and like kind of click off the comments and things, but it does show that it's a working document, so that's good. Okay, so let's continue. So in that strategic plan, there are 6 goals that have activities listed next to them. Should I like share what I'm talking about on that document? Would that be helpful? Or can everyone just look at that link that Kaylee just sent?
Thumbs up on your little reaction button if you want us to screen share.
Okay, great. Even if I see one, amazing. I'm going to mute myself because I have to find it. 1 second. Okay, can everyone see that? Okay, great. So I'm going to scroll all the way down to page 11. So here's that vision and mission, and then here are these goals: develop shared administrative capacity, evaluation, etc. So then this is kind of what we're hoping to focus on. When we go into these breakout rooms, each breakout room is going to be designated to a number. Your number breakout room is going to be this number. So whatever goal you're correlated with. So if you're in breakout room 1, you're going to kind of concentrate on these administrative capacities and these suggested activities. So if we could view the suggested activities and then make sure that that is what we want to focus on. If you want to edit anything, if you want to add anything, there's going to be a Jamboard, which I'm going to send that link right now. Oops, that's the wrong one. Oh, thank you so much for sending that. Sorry, I have like 2 screens, but I feel like they're not working very well. So sorry. Okay. Oops, that went just to Shin. Okay, we're doing great. There we go. All right, so here is the Jamboard also, but to kind of continue with what is going on with these goals, does everyone understand where to find these? Yes.
I'm seeing some thumbs up here.
Okay, amazing. Thank you so much. All right, so I'm gonna close that. So again, these are the goals. And then I think that the next slide is honestly just talking about the breakout rooms. Exactly. So please read what is currently listed, discuss 1 to 2 things to add and or things to edit. Yes, this is a draft working document, so sorry. So like, let's all work together to think of how to fix it. There's some good structure to build off of. And yes, Shin, if you can make the breakout rooms, that'd be great. Okay, so then the next thing that was just in the chat is a Jamboard. And I don't know if everyone knows how to work a Jamboard. They are like kind of all different. But so this is group 1. The link will go straight to this page, group 1, and then you just use this arrow to go to the next frame. So this is group 2. So you just find whatever working group you're in. This is instead of having a designated note taker, so it's more of a collaborative kind of interaction. So, but you can either put examples like what I said before about things that work well for you or things that you have found. And all you do is you just click on this sticky note, write whatever it is you want to do, and then you save it, and you can change it a different color if you want, whatever you want to do, and then press save, and then you can move it wherever you want. And so that's what you're going to be doing in the workout. or work breakout room, in your workout room. Okay. Anyway, does that make sense?
Jen, I think you may need to change the settings on the Jamboard so that people can edit it. Right now, I have a view only link.
Is anyone else having that problem?
And feel free to unmute yourself. Okay, now I think I can do it. Yep, I can add sticky notes now.
Great. So I just saw Willie. I'm on the mobile and able to listen only, no problem. If you get into a break room, just ask somebody to put down your ideas for you, no problem. Okay. Should we go into the breakout rooms? Does anybody have any questions right now? You can just go ahead and unmute yourself and just ask them.
I need a couple more minutes to get these sorted.
Okay, great. Also, I was thinking that if you're like, oh, I have no idea about an idea for administrative capacity, you can just leave that breakout room and then we can find a better fit for you too. Like, we don't want this to be stressful. We want this to be collaborative and everyone kind of share their challenges, their barriers, what's working for them, what isn't, and kind of move together as a team.
All right, all the rooms are opened. Jen, how much time do we have for folks to stay in this room?
I was just gonna say, I think that we were gonna do 20 minutes. Is that right, Kaylee?
Yeah, I think it's going to be more like 15 to 20 now, but that's okay.
Great,
Yeah.
we'll give you a 5-minute warning. And if you need us at all, I will be in the main room. So you can just pop back in.
Are you going into rooms?
Me?
Yeah.
No.
Okay, I'm not gonna go.
And Willie might
Couple.
not have the ability to get into a room.
Okay.
I'm
Well, you
assuming
might just have to hang out with us for 15 minutes.
Or can you put them into a room?
He's in a room.
Oh, no, I can move, or no. They have to accept like joining.
Yeah.
I just jumped off another hour-long meeting, so I'm going to take a really quick bio break here. And I will be back in a sec.
I'm going to pause recording for now.
Do.
Yeah, Kaylee, Shannon and I were kind of talking. So I think that we can just add people's conversation to that like meeting notes document. I don't think we need to like share the screen for the Jamboard, or do you want to?
I'm such a visual person. I think it's helpful, but
I just don't want to like put anyone on blast and like I feel like scrolling through might be a little difficult.
We can, how about we ask each group if they want to share their, yeah.
Good idea. Thank you.
Yeah. Welcome back, everyone. Let's see. I think that is everyone. Cool.
Oh, I'm gonna try to capture that last thing in here.
We just wanted to say thank you for jumping into these rooms, and that sometimes there's some pressure around like, what are we supposed to produce in these rooms, and like and maybe the prompt wasn't the one that you were hoping for or had a lot of examples around or really understood. So thanks for hanging, and hopefully even if you didn't really get to the prompt at all, you made a connection with somebody else that either you've talked with before, or you've never met before, and made a new a new friend or a new, you know, connection within this group. And that's one thing that we were really hoping for the in-person. But I know that we can still create some of that within this virtual space. So hopefully you got to know each other a little bit more and make those connections. And don't worry if you didn't like write a novel on each of your topic areas, because we're just kind of digging into this a little bit and processing, but the most important thing is those connections. So we're going to take the next little bit, and don't worry, we will give people breaks. So we're going to take the next like 15 minutes to report back as a group. And even if that report back is like, we didn't really understand this, but we got to know each other a little bit better, that's fine too. And maybe we'll just go group by group. Feel free to unmute yourself. Let us know if you want us to project your slide of the Jamboard, or if you want to project that too and kind of have control over that screen. If that's helpful, or if you don't care about showing it and you want to just give some brief highlight overview. So who did we have in group 1, which was around developing shared administrative capacity?
Michelle and I.
Great. Do you want us to show the Jamboard, or do you want to just chat?
I feel like I didn't do a great job with the Jamboard, but you're welcome to share it just so you already have it up for everyone else too.
Well, I was just gonna say, like, no pressure, because everyone can see it, so you don't have to.
Yeah, fair.
Yeah. And you did great. Like, no pressure. This is just like a brainstorming thing.
Yeah, and since this is the first time I've looked at the strategic plan, and I just like kind of learned a lot from Michelle. So Michelle, feel free to share. But I think administrative capacity is super important depending on the consistency of the group meeting and what the goals are for the year. And it seems like you all have done a pretty good job in having like support for this working group, but I think we talked about just having more capacity is really important, and also like shared support from members as well, so it doesn't just land on one individual. But if this is going to become like a statewide initiative or statewide coordination, like having an implementer who's totally focused on might not be specifically Veggie RX, but food as medicine, or kind of like food, like nutrition focused programming in the state could be useful. We kind of talked about how the mission and vision is super all encompassing. It's not just on produce prescription programs. And so some thoughts around that, which Michelle, if you want to share about that, I feel like you had a lot of great points, but to me as an observer and more of an outsider is like, what is the focus of the group? Is it specifically on like supporting Veggie RX program producers, or really like if you look at the mission and vision, is it this broader coordination of everything relating to food as medicine, just to use like an easy slogan? Yeah, and then greater utilization of the listserv, like having more interaction on that, because there's so much out there, and learning how to coordinate all of the kind of things that are happening in tandem, which is really difficult because there's so many different like rules and regulations and different changes to policy that happen all the time. But Michelle, would you share anything if you feel comfortable?
You might still be on mute, Michelle. We can't hear you if you're trying to talk. Okay, we still can't hear you, but if you have more thoughts about this, feel free to add them in the chat if that's easier. And yeah, thank you all for going first, breaking the ice here. And certainly if you have, like, after hearing Eliza and Michelle's thoughts around this, if you also have ideas around this or just things to add, you're welcome to jump in on this first page on the Jamboard, and maybe in a different sticky note color, add your thoughts on there too. But let's go ahead and move to the second group. Who did we have for establishing program evaluation strategy? Juliet and Elle. Do you want me to share this, or do you want to just
Either way.
see everybody?
Yes. Share it. We're very proud.
Yay, good. Take us away.
Okay. Do you want to, Elle, or do you want me to? Oh, it's loud in here.
Yeah, I can start off with my long one that's going into.
I tried to get it with this one.
You did it
this
beautifully.
One, and I think this one. So yeah, we'll see.
So to summarize all three of those, I guess I'm very new to the food systems and understanding agriculture. I'm learning farming and everything. So this is my first year, and I'm excited to kind of jump in head first and like kind of get in there. There are working with the community in Rockwood Village. I have been able to really kind of dive deep into the relationships with the families that live there. So we have a population of African refugees. We have Vietnamese. We have Russian, Ukrainian. We have so many different family members, and just people who live in that community. I guess I was wondering about surveying, and for those people who aren't really documented, which there's a large population of people who aren't, I'm wondering how they can actually benefit from these types of programs too, by being surveyed. I guess like having programs like ours with Feed 'em Freedom be surveyed instead of having the actual people be surveyed, because there's the fear of possibly being reported for not being documented, or them losing certain types of things, that funding or things that they currently have coming in, but they still need these types of food programs. So I guess that was something that kind of came up for me. And I have to go grab my front door. I'm so sorry.
Okay, awesome, Elle. And then I just was kind of talking about what we've done so far with having some interns from OHSU help with reporting, evaluation, and then how we developed this survey that's kind of a default survey for programs to use. So I think, the more programs that use that same survey, the more consistent data we'll be collecting. So kind of a simplistic maybe thing to put on there, but just so more people using that survey. And then I'm sorry we didn't get into like very specific examples. And looking at the strategic plan, I see there was like more specific prompts, but when I thought about this just kind of from a fresh perspective about program evaluation, I thought about how we do these participant pre and post surveys, but there's more elements to the program, right? There's the clinic experience, there's the retail experience. So wondering about like kind of a deeper analysis of programs beyond just the participant experience.
Thank you, Julia and Elle. This is great. You dove into this and brought up some really important items, and I just put the sticky note up of like participant versus participant level surveying versus, oh, somebody's covering it up. There we go. Okay. Versus program census. So like a deep dive into the program structure and like overall how many people are being served or how this is being funded or what's the mechanism for distributing food and things like that. What
Right.
Emily Carlson had worked on of like a more macro level of looking at these programs versus individuals.
And the other thing,
Go ahead, Jen.
The other thing that I would also add too is, I think there are a lot of different sources of where the food comes from, and being able to survey what that looks like, and how do we also better incorporate locally grown produce or culturally specific produce, and like how does that data then help in coalitions like the one that Eliza at Healthcare Without Harm with farm to institution, how do all these things then connect? Because all the work that we do here just in VeggieRx is still relevant and tied to the other parts of the food system as well.
I see another comment here about explore inroads with CCOs and covered services for the healthier Oregon population. Feel free to unmute yourself if you put this comment up there, but I'm also thinking like, how do we use this data to drive funding, but also looking at the healthier Oregon population and like thinking about our expanded OHP coverage for undocumented adults too. So creating a safety net for the folks that may be undocumented, but are newly able to sign up for health services or health coverage under OHP, and what that will change the landscape for VeggieRx programming. But I think maybe Elle, you might be pointing to this, and I'm curious what like Carla, your work at Adelante too, I know running into like barriers versus perceived barriers, and perceived barriers are entirely barriers themselves too. So it's one thing to say, oh, folks are eligible, but another thing to get past that fear of what that means, and not like having that unknown of like giving my personal information, what does that actually mean? So I think just kind of like diving into how that surveying and evaluation is happening on an individual level versus like more of that macro level, and are there ways to capture information that's really important to drive and support these programs without having to put the burden or stress on an individual that's accessing these. Hopefully I'm like capturing those ideas all right. Okay, oh, and there's chat comment here. Survey template, thank you, Shin. Yes, we do have a pre and post program survey that exists on the drive. And context for beginner and rancher working group and land access working group came together to apply for a grant from Roundhouse Foundation to fund. Okay, I'm not sure if.
So that was just the context in terms of, what we talked about in group one, and in terms of additional capacity, and also just around, around just how capacity and the ways that particular working groups and arms of OCFSN historically have been able to get like a full-time staff person has been through the working group advocating, deciding what grant to apply for, and then funding that individual. And then like with all, I think one of the things that we see with like Farming for the Future, or whenever there is a focused coordinator where that is their job, because I think all of us on the call here have many full-time, already have a full-time job, right? And so, once you have a focus coordinator, it's very easy to make the case for the amount of kind of exponential like focus and just things that can happen.
Great. Well, thank you, Julia and Elle. Again, if you have any other comments or questions for this establishing program evaluation strategy, feel free to put new sticky notes on there. Let's do one more report out from group 3. around, you guys just, yeah, use this board. I love it. For systematization, streamlining statewide program operations. And then we'll pause, take a break, and come back and do the next 3 groups so that we can move our bodies and get some fresh air or whatever you need to do. So who do we have for group 3?
It's me, Carla, and Emily. Carla, do you want to share first?
Yes. So actually, the first part that I want to share has to do with number 2, with what group number 2 was talking about, evaluation strategy. Because recently we were working with an outside evaluate or outside consultant organization to help us go deep. And so when I mean go deep, it's focusing more on the changes that Produce RX programs have on people's lives. Like they're not just illnesses, like not just focus on illnesses and at times kind of shaming them because they might have a diagnosis for obesity or diabetes or things that is kind of shameful for them. So it was interesting that we were able to do these interviews. So I brought it up with my group and just letting them know that it has been very beneficial, because when you reach out to the funders, they want to see numbers, of course, but they also want to know what are some quotes, what are some changes, what are some more direct changes to these people's lives. But then there's like so much going on right now. The conversation has just gone all over. I have so many things to say, but I'm trying to stay on track. So we also talked about the importance of, if we want this network to connect, to stay connected, we need to meet at some point in person. Like we need to get to know who we all are, because I had no idea any of you were on. This is the first time I've seen a lot of your faces. And likewise for me, sometimes I don't turn on my camera, and I think that these online, now that COVID is semi over, we need to engage, because there's a lot of things we could help each other out with. And there's just things that Ellie, you had just said, I was like, oh my gosh, I need to tell you about this. And I haven't had a chance to let you all know it in this network, in this group, because I just haven't had the time. I also think when things are in person, we're more engaged. When we are online, we're all doing all of these other things because we're running all these other programs, we're running all these, and we all have other things going on. So I think that's why it would be super important to be in person. And then we were just kind of jotting down things, and the things that I was talking about is that we are leaders in the community, and I don't really know, again, what are we all doing. So it would be nice to have a moment where we can talk about what's working for us, what are our challenges. And I know you have set this network to be like that, but I think it's gone off on a tangent like I am right now. And then another thing is, I wanted to understand a little bit more about, we were talking about media, and I really am learning a lot about media. I don't really understand it. And so it's great that we have a new marketing manager here at Adelante Mujeres, so that he can help me with that. But I don't know, it's hard to market. There's a lot going on with Produce RX. It's not just people need money to buy foods and they have a diagnosis and they need to eat healthier. There's a lot of food insecurity, which we've talked about, but we don't talk enough about it, actually. And a lot of case management going on, which I'm learning a lot more. It's like once you incorporate somebody into the program, they have a list of other things that they need support with. And then it doesn't become just Veggie RX or Produce RX. It's like, oh, this is like a whole case that I need to open. So just, these were thoughts that popped up in my mind. If we wanted to streamline and do a statewide program, we'd have to really get to know each other first before we do that.
Thanks, Carla. A few things that I'd love to add are, one, for a long time, I think Kaylee and I and lots of people, I'm sure at this point, I don't even know. So field questions from random, either it could be patients, or it could be clinicians, or it could be nonprofits that call and ask, hey, I'd like to start a program, or I'd like to get involved, or I'm looking for a clinic that, from all sides of it, people are looking for Veggie RX or looking for ways to participate or start a program. And so one thing I think that we need a statewide coordinator. Like that's what I really feel very strongly about that, because somebody who's full-time paid can think holistically about all of this, can then wrap their brains around like, okay, public facing, what does that need to look like? Okay, internal, what does that need to look like? And, you know, having a website that's really cohesive, that shows people where the clinics are and who's participating, which nonprofits they can contact to get involved. And then showing a toolkit, like the awesome Adelante toolkit that exists. It's, I really think that we need to have we need as a group to come up with what our ideal program looks like, regardless of what our programs look like. What is like a really standard program look like? And let's put all the pieces of that together publicly so that people who want to start new programs are all on the same page moving forward. Because right now we all have our individual programs and that's fine. But at some point, if we want to standardize this, or if we want to have a statewide grant, then moving forward, people they don't have any programs. So they're starting from scratch. So they might as well create a program that's standard. And then, you know, once, and another thing that I said was similar to the double up food bucks. It's like, once we have a funding stream that's coming from a greater, like a federal source or a statewide source, then we'll all decide whether or not we want to get on board with whatever the standard is, you know, so or whatever the branding is, or what, I just think that we can conform as much as we want, but moving forward, the programs that aren't in existence yet, they don't know from anything. So they might as well start a program that looks very much like what we as a group have come together and set up as a standard. So I just think that there's a lot of I think the next step is really having a person in charge to lead the way, and just not even in charge, but just help coordinate all of the ideas. And I think that, yeah, so I'm making the OCSFN website a little bit more robust would be really helpful. Thanks.
I'm just going to add a couple of things as well. I agree with everything you both just said. I think it would also be really beneficial to have a very focused conversation on this topic, on standardization, as well as just really nailing down the definition of VeggieRx, at least within Oregon. Just while doing the census, there was a handful of programs that were functioning really similarly and getting at very similar goals, but you know, maybe they didn't actually have a prescriber or something that differentiated them in some regard. And so it was unclear whether they should be included as VeggieRx or if there's something different. And so that made it hard to even compare VeggieRx programs to one another and to get a sense of where VeggieRx in Oregon is currently at. But also trying to not include those programs because they are doing great work and getting at similar things. So yeah, I think simplifying and getting out what is VeggieRx, how does it function at its very core, and what are the goals of VeggieRx, whether it's focusing more on food insecurity, diet related illness, both, or if it should be one or the other, whatever, but having a very focused conversation on that. And then also with that, having a deep conversation about standardization and what programs are comfortable and willing to standardize, and then what other things should be left to be program and location specific. And also knowing that they don't all have to be standardized. And then with those standardized elements, make them really accessible for programs. And like Nicole was saying, have them on the OCFSN website, really easy to access. And then, sorry, my brain is also all over the place. And then we also kind of talked about having some, statewide logo for VeggieRx once we have that definition nailed down, that can accompany the more local program specific logos. So it doesn't have to be an either or kind of thing, but I don't know, there can be some marker that these programs are connected with one another and are functioning a certain way, which maybe could make it easier to vouch for VeggieRx as a whole and to gather those funding streams, similar to how Double Up Food Bucks has done so. There's probably things I forgot, but that's most of it.
Thanks, you all. I think what I took away from this too, it's like there's so many things that are interconnected for each of these strategic goals. So as you were, even that last comment about having marketing and branding kind of around this as a statewide thing, and local branding, right? That was another strategic goal too. Or talking about, you know, Carla, you were like evaluation, but this also talks about like this systematization and like streamlining of these things. And so thank you for digging in deep and like making those cross connections and the intersections between this work, because I think you can't really just parse out one, or it's hard to parse out just one part of this because it all is kind of working in collaboration. So I want to make sure people can move their bodies and get some water. Let's come back at 11:26 and we'll, so you have 10 minutes, 11:26, be back on and we'll dive into the next 3 working groups. Thank you. And Jen, really quick. Oh, let's bring the next couple of groups here. So let's continue on with group 4, and I'll share my screen again. Who do we have from group 4?
Hello, everyone. That's Marcy McMurphy and Tina Andrews. We work together, and thank you, Kaylee, for answering our call for help and coming and giving us a little bit of direction on this. We appreciate it. So when we're looking at developing marketing and communication tools, I think it's an important goal if we're looking to increase programs and improve programs across the state. So I think this is one that I think that answer is yes to both of those. We do want to increase the programs, and we do want to improve the programs. So what we were looking at is a lot of organizations have their own forms and their own documents that they use, but then like developing one that is an overall is a little bit harder. But maybe what would be easier is having an elevator speech that like all organizations can use when talking with community champions, legislators, funders, having just like this very set, like this kind of answers all of the questions. Well, not answers all of them, but at least gives you like a good little snapshot of what the programs are, so that at least all of these people will be hearing like similar things, so that it'll start really getting ingrained into them what it means. Something that we thought would be great would be to assign like mentors and mentees, so that a new program coming on board can maybe be connected with a program that is more established. We also liked the idea of providing quarterly trainings for new interested people in the program, and have those be provided by those with established programs. Also, I think developing a video series on just the general produce prescription program. And I know that many of us have individual ones, but again, just having kind of that elevator speech, that elevator video program that just talks about the very basics of Frontier, or of the Veggie RX. Of course, providing example documents, which we have a bunch of those already. And I think that the thing that we maybe struggled with the most is it's difficult to really distill down to like single documents. And I do like what was said previously about like, what does the ultimate program look like? And maybe design documents around that like ultimate program and have those be available. And then I wanted to give Tina an opportunity to add anything that she was maybe wanting to share.
Yes, thank you. I think Marcy covered our discussion very well. Another thing that we talked about is the idea of having materials that are marketed specifically for consumers versus professionals, and then keeping in mind health literacy when creating documents as well.
Great. Thank you both. This is excellent. Some really good steps forward of what would be helpful in this thinking about communication tools and marketing and things. Thank you. And thanks for calling for help when you didn't know it was happening. Great. Let's go, unless somebody else has any questions or anything to add to this, we'll move on to group 5. And who do we have for group 5? Oh, and also Juliet said, love these ideas. Some of our programs already have some of these materials, but they could be improved and standardized. So why is this? Another program could use them and customize for their programs. Great.
So,
all right. Oh, hi,
5,
Megan.
Hi. Group 5 was me and Angel and Shauna. And Shauna, I'm sorry if I'm mispronouncing your name. And we talked about research and based policy and advocacy activities. I think a lot of what's already in the working document are the pieces that really resonated with me. But some of the things that I know that I'm struggling with in our organization that I would love for some OCFSN help with are really around that Medicare funding of like, I hear this is a thing. I don't know how it works. I don't know how my clinic staff can actually do a referral and bill for it and get paid for it. Similarly, I know there's a lot of work right now, at least with HealthShare, in figuring out how are the 1115 waiver dollars going to be implemented. And I know that our health system was just asked to provide feedback around like, what are we doing and where are the struggles and, you know, what the lift is going to look like. And I feel like this would be a really great place for OCFSN to be at the table, to be able to provide input of like, this is what's worked well, this is what hasn't, and here's what the research says of how you can do this. And then what else did we talk about? Oh, so as far as things to advocate for, one of the earlier groups kind of mentioned this idea of, I think it was the person from Adelante Mujeres, that like this is work for our clinic staff and our care managers to identify individuals with a food need and to do the referrals and the tracking. And the way the OHA policy and the funding is set up right now, there isn't really a way for our health systems to bill for that. And I think that is a challenge that we need to figure out. And I think that is a space that potentially OCFSN could help out with. And then we talked a little bit about community health workers and how, which I think is also written in that document, of like really figuring out how they can support this work. And then some additional advocacy around, you know, not, and I know there are other mechanisms for this, but not just having vouchers for VeggieRx, but something that's easier for folks to use, that's more integrated into, you know, whether that's or an Oregon Trail card or WIC, you know, whatever, something that so you don't have yet another form of payment. Angel, Shauna, anything else that I missed?
No, Megan, thank you so much for taking that. I'm just gonna reiterate a little bit, just because this is what I'm running into pretty much on a weekly basis at work. It's that I'm kind of going in circles because people in the state are doing all of these things that Megan just mentioned in different ways. There's different ways of funding it. There's different ways of partnering in the community. And so it's like, well, how are we going to fund this? I mean, these is leadership asking me, how are we going to fund this? And I'm like, well, here's what this place has done, and here's what this organization is doing. And then it's like, well, how do we make a referral pathway? How do we cover this? And so, I'm going back and kind of collecting and using the census, and there's so many different things, and it's a sticking point. And at the end of the day, when leadership is having budget discussions, they want to know how much. So if we were to fund this, how much should we put in the budget for it, and for which population? And I really love the theme that I'm noticing in all the groups, really about streamlining. In as much as we can, to make it accessible for organizations to plug in, versus doing all this different type of work and making extra pathways, extra forms of payment, extra vouchers. It's great that people have been taking the lead and doing this for their communities. And I think we have so much momentum in this group. There's momentum in Nutrition Oregon campaign. There is so much expertise behind this that if we can just unite and get something standard, the state is behind us. I just think, there has to be some sort of way that we just decide is going to work the best for the most people, and present it and go on it. So, yeah. Thank you.
Thanks, Megan and Shauna and Angel. Yeah, I think you're bringing up some really great points and tension points too, because I think there's this tension between like standardization and responding to the unique needs of the communities that we serve in different regions, and the resources and pathways that we've all built based on just like the resources at hand. And systematization can help the efficiency and scale of these programs. And I do, and maybe this is the optimist in me, but like see a way where there can be standardization, but also not losing that, those unique qualities of specific programs that are using the resources in their areas, to really create programs that are working for the people, instead of just thinking of quantity, like continuing to prioritize that quality aspect of these programs while finding ways to standardize that. And also that tension between, we could standardize all day long in this Veggie RX group, but I think maybe what you were saying too, Shauna, or touching upon, is like CCOs operate in different ways, and they have different workflows and referral processes and billing processes that they use. And so as much as we standardize, like there is kind of that disconnect and need for a standardization for food as medicine programs on a larger, like, and sorry, I realize I'm stopping myself here too, because there are CCOs that are creating programs. I'm looking at you, Marcy, too, and others in the room. But in general, like these individual Veggie RX programs and the individual CCOs that are trying to bill for or create these workflows, like we need to be thinking on a larger scale in the policy, as you all brought up here, and advocacy around how do we make those things happen in concert, and how are we talking to each other and coordinating between these different components. Is that, I thank you for bringing up all of these things, and hopefully I'm summarizing some of this in a good way.
I think that sounds right, Kaylee. And I think there's here's best practice, right? And here's how you do these things. And then obviously there's going to be modifications based on context, but then that's when you can be like, all right, here's either a case study, or here's some things that might have to be modified. And, this organization did this and that organization did that. And I mean, but having a template of some sort to get started with, instead of feeling like, right, I read all of these journal articles, I read all of these reports, and now I have to put together a framework. It's daunting.
Certainly, yeah. Well, thank you, Group 5, for putting your energy into this. And certainly last but not least, we've got group 6, and definitely not least because this is one of the top concerns and stressors, I think, for any program is looking at finding a sustainable growth and funding plan, and just funding in general can be really tricky. So who do we have for group 6?
I can start. So just to kind of really piggyback off of what Shanna said, one of the big sticking points we had is just kind of that issue of, like you guys were saying, standardization is so important, but also every community is so different. But it's really kind of overwhelming to know like exactly how to get started with this, that it makes thinking about sustainability like way more in the distant future. We thought about strategies would be like just increased resource sharing between orgs that already have established Produce RX programs, to kind of have a sort of resource hub or sounding board of kind of creating best practices, like this is what's worked for us. We've tried this isn't great. Just to kind of have that resource to go to for interested organizations that want to get something like this going. Another thing is budget examples. So again, it's going to be really different probably from community to community, but being able to say, this is how much funding is necessary to get it going. Do with that what you will. Just to kind of have a better idea of what you might be getting into. And then having work groups focused on leveraging data for specific funding sources. So like having like a CCO fund it, or like what it would look like for a different healthcare institution to fund it, just like different options. So really, I think our whole thing was just about building connection within this hub, so it feels like we're all working together and kind of can be a resource to each other. And Jazz can come in too and add anything I left out.
Yeah, no, I think a lot of these points we kind of touched on in the previous groups too. I think the waiver is definitely of interest to a lot of folks and trying to learn more about what that looks like. I did attend a different an OHA work session a few weeks ago about how community-based organizations can participate in implementing some of the different waiver initiatives. So I'm happy to send like Shin and Kaylee some of the information and PDFs that came out of that work session for folks who are interested in that. But yeah, I don't feel like I have too much to add. It's a big discussion and conversation, and yeah, one step at a time.
We need to create a new like hybrid money tree, and then it'll be the new crop of Oregon and it'll pay for all of these programs. Thank you both for tackling this one. I feel like it feels like a monster a little bit in like how like, and like you said, Olivia, kind of people are just starting out, so it seems like far off to think about the sustainability of the like long-term funding planning, but important to address no less. All right, I'm going to stop sharing so we can see people's faces here. And we only have about 15 minutes left. So with that time, we're adjusting our agenda just slightly. But based on kind of what you all were hearing from those different strategic plan goal groups, and thinking about your program, but also thinking, I think what Olivia was mentioning too, like how can we come together to have more collaborative work and supporting each other in knowing what the challenges that we're working on, like, so thinking in a collective way as well, how you might prioritize those strategic goals. Also knowing that there are constraints and limited capacity. And so where do we want to put our energy most into those? And I think Jen or Shin might have a poll. Okay, cool. So you can rank these and putting 1 as the top priority and 6 is I just see the presenter view on this, so I'm not sure how this is displaying to you all, but if you can select top priority in your mind. Those are starting to come in here. I know it's really hard to prioritize too. It looks like we've got about 11 people of you answered. We'll give you a few more seconds here to finish up your choices, and then we'll release that so we can kind of look at pulse check for folks. And that doesn't mean that like we can't work on all of these simultaneously and pick away at some of these, but just getting an idea of where people are, there's excitement or feeling like there's a real need around these. All right, last call. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, I'm gonna end this poll and we're gonna share the results here. So it looks like, if I look at the ranking, okay, let's see, let me make this a little bit bigger. So it looks like there was quite a bit of interest. So the light blue means like #1 top priority, that systemization and streamlining of statewide program operations, followed up closely by that develop shared administrative capacity and developing sustainable growth and funding plan. So what I'm trying to look at on these is like the blue, light blue and dark blue are bigger priorities here. And red, least priority, is developing marketing and communications tools and maybe some of the evaluation work. And that doesn't mean like, and I don't know if I were taking this poll too, I would say some of the like evaluations programming we already have in place. So Shin mentioned that we have pre and post survey evaluation like tool that we've created, and Emily put a ton of work into this like census that we've created on a program level. And so I think not that we need to deprioritize that, but we have some tools in place that we don't need to, that we don't have to recreate those things, and we can continue to use those and spend more energy in some of these other spaces. Does anybody have any like comments, questions about this? Any observations, ahas that come to mind?
As I was answering the priorities, I was kind of thinking about it in sort of the plan, do, study, act cycle. So, if you're looking for somewhere to start, strategy's a good place to start. So you know what you're trying to do before you implement it. Kind of how I approached my answers.
That's great. Thanks, Tina, for the problem solving brain, like the organizational brain. I love that. And thanks, Megan, for being on here today. Okay, I'm going to stop sharing this. And with our last 10 minutes, we do want to accomplish kind of how are we moving forward with things. And I'm going to pass it off to Jen, if you're ready for this, to talk a little bit about that in-person gathering possibilities, and then kind of more scheduled dates for virtual meetings throughout the year.
Okay, sorry. Can you see the screen again?
We can. We're on the screen that says 3 questions we need to answer today.
Right. Okay, I was just going to kind of come back to this. Try to kind of maybe think about how we can get more involvement in this working group. Again, I know that the in-person thing is really important in making those connections, but and we kind of already passed like the prioritizing aspect of it. And then this is kind of like talking about how often do we meet? How do we make all this amazing work that we're trying to get accomplished actually happen? Like what's like the next step? So sorry, this is kind of a weird layout though, but so we're kind of talking about in 2024 having quarterly meetings be more structured. So this is like a draft. We don't have to have funding in January. We were just thinking of fiscal years and kind of having more of like a working group aspect of being like share knowledge, specific things that we want to go for as a group, what's working for people, and then reflecting and relationship building or something like that in March, and then guest speakers or information sharing or meeting together in July, and then talking about evaluation or something specific in October. So this is just an idea. We don't have to do this. It was just kind of getting the feedback of people not being able to meet in person in the summer. And I know that that is like, because it's everyone's busiest time. So these are just possible next steps. And that's kind of all that we have right now. If anybody has any feedback regarding that. But I think yeah, and then that's it. That's all the slides that we have. But we can kind of get into a little bit more of a discussion of like how to make that actually happen.
And I think if I can just clarify too, so the times of the year, what we're proposing right now is having quarterly meetings, maybe looking at, instead of an hour, maybe that's an hour and a half to carve out of your time so we can dig a little bit deeper. And like Jen presented, there's like different subject areas that we could cover for those quarterly meetings, but like diving deeper into a subject area versus trying to cover a bunch of different things all in that one time period. Again, those don't, like, we can put funding in July or evaluation in January. We can mix and match where those go, but we're just wanting to give an example of what that might look like. So we would love your feedback on the quarterly meetings, an hour and a half sound good, and that if there are specific deliverables that need to happen between those quarterly meetings, we can form, subgroups or meet outside meetings from that if people really want to dig into evaluation and we need some more follow-up meetings between those quarterly meetings, we can schedule those as needed. Oh, and we didn't mention on that slide, Jen, but like we are thinking we still want to do this in person. And when are we're thinking in the fall winter time period to gather everybody in person as like program operations are kind of slowing down for the season.
And again, part of the intent too is, I think since we've started gathering again post 2020, it's been a little bit more ad hoc, and all of us just trying to figure out what do our programs look like, what's happening right now, and and that all led to Emily's census last year, which really helped us identify who else hasn't been in this room potentially. And so I think being able to shift to quarterly calls, that gives all of us a little bit of consistency, but in a way that's not as, I think, intense as every single month, because we don't necessarily have specific things that we need to talk about on a monthly basis. But this way, because our programs are, and this work in general is kind of seasonal, it helps all of us, I think, at least I know for me, it helps to build in some of those recurring habits and conversations. So I think a lot of these things are cyclical conversations, and it's good to check in on certain topics every year as well. And then I'm sure we're going to follow up with a survey for when is a good time to meet in person. But if there's a particular month between, let's say, November and February of that's upcoming, just drop that in the chat because we'll be able to save those notes if folks have some point of view at this point. Oh, and one of the updates I forgot to share was, I know we had mentioned a while ago that with the support of Jen Chandler from Oregon Health Authority, we had applied for the CDC SPAN grant, which would be a 5-year grant. And we should hear back about that before the end of this month. So fingers kind of crossed for that, because what that will allow for is some funding for this working group, as well as a bucket for pass-through grants. And part of that, I think, as a reminder for folks who maybe it's been a while since we talked about it, but that was also one of the 2 reasons that we were trying to meet in person by August, was to be able to start thinking about, okay, if we get this funding, what types of grants, pass-through grants, do we potentially want to offer? What do we want to focus on? And yeah, I think that's all I've got today.
We can certainly send out one contact information as a follow-up to this group. It should all be in the calendar invite, if you can see that too. No, you can't see that. Okay.
I can see it, but when I wanted to do a reply to all, it did not, all of the names were there. So maybe if the forwarded, I don't know, if maybe, I don't know, I don't see everybody's name there unless I.
How about this, Carla? If there's folks that you want to reach out to individually, that we can help match make, and or as like a follow-up when we send out the recording of this meeting, we can send a list of attendees if everybody's okay with having their name and contact provided on there. Cool. And not to glaze over to what Nicole had written out there, about focusing the next year potentially on finding and writing a grant for a statewide coordinator. I know that came up in a lot of the strategic planning breakout groups, to actually do tackle all of these pieces to the strategic plan and keep us all on track and help rally everybody together. I don't think we have time to really dig into this right now, but I think maybe that could be a subject for in-person and or the first quarterly meeting that we jump into. Awesome. Any last minute thoughts, ideas, announcements? Very focused on strategic plan and what came out of today's polling and breakout groups. Cool, Juliet. Yep, we can really hone into that. More of workshops than meetings. Okay, cool. Love that idea. All right. Well, thank you for your engagement in this, jumping in here, getting excited, connecting with one another, connecting the dots between all of these pieces. We so appreciate you, and we are so excited that you committed your time and engagement into this process, and we're really looking forward to streamlining and to really focusing in and taking small bites away from these big projects and what seem at times kind of overwhelming in that process. But I think if we're really committing to this as a collective, it doesn't seem so overwhelming. And just being in community with you all today virtually, I know has for me personally felt like a boost of caffeine to like recommit to this work and make sure that we're going forward. So thank you, thank you, thank you.